During the pandemic, restaurant dining has proven to be a hard sell. 1 in 4 Americans, 25%, do not feel comfortable dining out at all until a vaccine becomes available, according to a recent YouGov survey fielded for SevenRooms, a travel booking service. About the same number, 23%, say they'll continue with takeout or delivery for the rest of the year. Not even 4 in 10 Americans, 38%, are looking forward to dining out in the next 3 months. And of that fraction, a considerably higher number say they prefer outdoor seating, 42%, to indoors, 29%. Now a new study by the Centers for Disease Control and Prevention appears to indicate that visiting establishments with on-site eating and drinking might elevate the risk of becoming infected with COVID-19. The CDC identified 314 symptomatic adults tested for COVID-19 at 11 different healthcare facilities across 10 U.S. states: California, Colorado, Maryland, Massachusetts, Minnesota, North Carolina, Ohio, Tennessee, Utah and Washington. CDC personnel asked the participants whether they had a variety of community exposures in the 2 weeks prior to being tested. For most behaviors, participants with and without COVID-19 reported generally similar behaviors. For example, the COVID-positive respondents were no more or less likely than the COVID-negative respondents to have gone shopping, attended small gatherings with 10 or fewer people in a home, gone to an office, visited a salon, attended a gathering with more than 10 persons in a home, visited a gym, used public transportation, gone to a bar or coffee shop, or attended a religious service. There was, however, a significant difference when it came to dining out in a restaurant. Respondents who had tested positive for COVID-19 were twice as likely to have reported eating out during the previous 2 weeks than those who tested negative. Efforts to reduce possible exposures where mask use and social distancing are difficult to maintain, such as when eating and drinking, should be considered to protect customers, employees, and communities, concluded the CDC researchers. The CDC's investigation did not discern between participants who had sat indoors and those who dined outdoors at restaurants. Many health experts consider outdoor dining to have a lower risk for coronavirus transmission. In its guidance for restaurants and bars, the CDC states that the risk of COVID-19 spread increases as follows. The CDC study comes several months after a JPMorgan Chase study also linked surges in COVID-19 to restaurant visits, as CNBC reported. JPMorgan cross-referenced data from 30 million Chase cardholders with Johns Hopkins University's COVID-19 tracker and found that higher restaurant spending predicted a rise in new infections in the same state 3 weeks later. Jesse Edgerton, the analyst at JPMorgan who conducted the study, called in-person dining particularly predictive.